Good morning. I'm glad you're all here. We have a very important announcement, something that Senate Republicans are very proud of. We're going to offer more solutions related to the insulin issue. We're calling it the Minnesota Insulin Assistance Program. The senators behind me will talk more about that, but I want to go back to where we were prior to this announcement today, because a number of things have happened since this last session, or during the session and then since the session, that I think people should be aware of, because we think this is an important issue. We've been focusing on this issue. We know that there has to be access for insulin for all, and we had to find a way through it. And so during the session, we passed a number of pieces of legislation, emergency insulin supply, language that basically encouraged the health insurance companies to lower their costs because they couldn't make a profit on insulin. And you saw that right after session ended that we had a number of companies that either charged a maximum of $25 a month for insulin or even free. Those were big steps. In addition, as we were just finishing session, you saw that generic insulin rates were cut in half by the pharmaceuticals. So many steps were happening and moving forward, and yet we ran out of time at the very end. And that's typical of sessions. You don't get everything done when you want to get done. So you need to know that we continue to work on that, and we have some announcements today that we think the governor and the Democratic House will also support, but you'll have to ask them. But these are solutions we think should get bipartisan support. With that, I'll turn it over to Senator Pratt.
Thanks, Senator Guzalka. For those of you that don't know me, I'm Eric Pratt. I represent Senate District 55, which is Scott County. Thank you all for being here this morning. As Senator Guzalka said, we recognize that Minnesotans are struggling to afford insulin. And I believe we have a plan here that will help fix that. This morning, Minnesota Senate Republicans sent the governor a bill that will help make insulin available to diabetic patients that are struggling to afford it. It's a good plan, and I believe it's one that we can get implemented by January 1st. Now, first and foremost, I just want to say that this plan provides the resources to make insulin available to people struggling to afford it. Now, we achieve this by setting up the Minnesota Insulin Assistance Program that Senator Guzalka just talked about, where we allow folks under 400% of the federal poverty level to qualify for this program. Just to put that in a context, that's a single person making nearly $50,000 a year and a family of 4 making over $100,000 a year can still qualify for this program. We're bringing both the state and the manufacturer resources together to be a part of this plan. And we believe it can be implemented quickly. And like I said, I would hope if we could get this going, we could have it up and running by January 1st. I was part of the bipartisan working group that met after session. And I know that we talked about that the only thing that we had a problem with was we couldn't agree on the funding source. And that it wasn't true. I had several concerns on this, on where we were at. But, this plan really builds upon the discussions and the work that we had within that group. I want to thank Senators Abler, Jensen, Anderson, and Housley, who I was able to join with at the end of session and help bring this topic up as something that's important to our colleagues. And I especially want to thank Senator Benson for her partnership over the last several months as we've worked through many different iterations and plans to bring this forward. So here are a few key differences between our bill and what the House Democrats have proposed. The Democrats cover a 90-day supply of insulin. And the question I had in the working group and the question that I continue to have over their plan is, what do you do after day 91? Insulin doesn't become any more affordable after that 90-day period. So this allows someone to get a stable supply of insulin for up to a year before they have to requalify. Their plan focuses on being in crisis. We're trying to avoid as many insulin patients from being in crisis as possible. The House plan would take 9 to 12 months to get implemented. We think we can have this up and running in 60 to 90 days. Now, our solution has a sunset because this is not the end-all, be-all solution. we have a bigger issue around pharmaceuticals, and Senator Benson's been working on this, but we need to get a stopgap measure in place for insulin today while she continues her work and keep that sense of urgency going. Our solution does have a few state funds in there for MinSure to be able to run the program, to do the qualification, and honestly, for people who qualify for a public assistance insurance program, help them get enrolled. We want them to be insured. But we also have the manufacturers providing the insulin to the patient, and what we've tried to do is streamline that distribution channel, one that already exists, so it's not disruptive to doctors or patients, to be almost a direct-to-consumer model. Now, as Senator Gazelka said, we've taken a multi-pronged approach to how we deal with this. The cost sharing and the legislation that Senator Benson's committee passed last year did help bring down the cost of the co-pays. And that's great news for Minnesotans, because more and more Minnesotans now have access to affordable insulin. But we still have the uninsured and some of the people still on high deductible plans that we need to help. So we believe this is the right solution for Minnesota, and I want to encourage the governor and the House Democrats to engage with us, to have this conversation, and to bring this forward so we can get it implemented as quickly as possible. And with that, we'd be happy to take any questions.
Senator, the manufacturers provide the insulin, is that correct?
That's correct.
How do you ensure that that happens?
How do I ensure that happens? It's in law. They have to, as part of doing business in the state of Minnesota, they will comply with this program.
And so then what is the advantage that we don't have another state program? Is that why you're arguing this approach as opposed to what Democrats are suggesting?
Well, I mean, the Department of Health is in disarray. Senator Benson's committee, I think, has shown that.
Human Services.
Or Human
sorry.
Services,
No,
go ahead.
No, please.
Okay. And so what we've wanted to do is really try to minimize the amount of government involvement. If we can do a direct-to-consumer approach through a distribution channel that already exists, then why would we want to recreate a whole new bureaucracy for a short-term program? Yes, sir.
Yes, two things that I see this in here. It says doctors will use patient eligibility statement. Now, currently, I happen to be there are people who, when they go to get their insulin, even though they have a prescription, consistently, even when they're on MinSure, every month are having to prove that they still have type 1 diabetes or that they're eligible for it, and this causes a stall in then getting the insulin to them. So how long is that eligibility statement for? Is it for a year? Is it for 2 years? Is it lifetime? Is it one? Because once you have type 1 diabetes, you don't not have it. My other question is, in that same line, you say the preferred manufacturer. Who decides the preferred manufacturer? Does a patient get the right to choose what works best for them? Or is it the doctor who says, oh no, we're working with this manufacturer because we got to deal with them? I mean, we have to talk about that factor of like where the money comes from for that.
Well, thank you. Well, sorry. Thank you for that question, sir, and I recognize you. So first of all, we're doing a one-year qualification. We want that stability. We want to make sure that insulin patients don't have to go in every month, every quarter to become re-eligible. This is good for a 12-month period. The point being that we want to bridge them until they hit that open enrollment period for insurance and they can get insured, or until they can get on one of the public assistance programs. To your other question, that's a conversation that happens. Who the preferred manufacturer is a conversation between the doctor and the patient. And that is my presumption is that is how that initial prescription was made. And so we're just trying to reinforce that. One of the things that Dr. Jensen has talked about repeatedly, and even mentioned it on the Senate floor, is that we need to reconnect and we need to strengthen that relationship between the doctor and the patient. And we really want the doctor and the patient together making those healthcare decisions.
Senator, do you have buy-in by pharma on this, solid buy-in? Are they supporting this bill?
Again, we've talked to pharma. We know about their distribution channel. Again, I wouldn't say that they are happy with this program. I think we've pushed pharma, probably further than they would have wanted to go, but we expect that they will do business in the state of Minnesota and they'll comply with this program.
Will they not lobby actively against it? Is the indication from them that they will let the legislative process, if you can get agreement with the Democrats, that they will not try to torpedo it, for lack of a better word?
I'm so used to people lobbying against my bills, it's nothing new.
Is this a bill for 2020, or is this a bill for potential special session?
This is, I have in the bill January 1st. I expect this to, I would hope that this could be a special session bill, but I'll let the majority leader speak to that.
I'll ask that and go back to him on more technical questions. So I did have a chance to talk briefly to the governor and the speaker. They know that we're doing the press conference today, and I indicated to them that if they were in agreement on this direction, there's no reason we couldn't do it early. And Senator Pratt mentioned that just think about January 1. All the other things that we were proposing or either side was proposing would have started much, much, much later, even if we'd passed it in a special session. And so you're going to have to wait for his feedback to see where he is after we actually did this press conference. But we are open if that's the direction we go.
So is it your indication, is it your indication that requiring manufacturers to provide free insulin satisfies what Democrats say they need in that the companies have to pay for this?
Well, that's what we were trying to listen to what they were talking about, and it was our assessment that this was a solution that could answer the question that they had as well, and that's what we have to wait and see. But we do think that it does, and we can do it quickly if they're open to it.
But
So
this
what
is,
kind of feedback did you get from the governor and the speaker?
Openness. This is a bipartisan issue. We recognize it as a serious problem. Both sides have recognized this as a serious problem. The Senate typically is more thoughtful on how we approach situations. We do a lot of work that we don't always necessarily say that we're doing the work, but we've never stopped working on this issue. But it is a bipartisan issue that I think we can get done, and this is a solution I think actually works.
but this is meant to be a shorter term, more immediate solution to the problem.
Mm-hmm. And I'll let Senator Pratt answer that one.
That's exactly right. I mean, Senator Benson's been working on a more comprehensive approach to this problem that would transcend just insulin. We don't want to be passing a bill for every single drug out there. We also want to make sure that we're open enough to allow generics and biosimilars into the market. So this is a stopgap measure until we get a longer-term, more comprehensive solution up and running.
Senator Pratt, there are income limits, obviously, on this. What about people who are above that income level who still find it very difficult to afford insulin?
That's a good question. I mean, anytime you're talking about eligibility, there are cutoffs. You know, we believe that this 400% with an individual making nearly $50,000 or a family of four at over $100,000 really covers a large percentage of those people that are struggling. But I think we'll have to wait and see, and we've rolled out the plan. Now we're open to feedback on it.
Was this a discussion or a topic and an idea that was discussed by that ad hoc committee, and if so, what was their response to it?
This wasn't a topic that was discussed by the ad hoc committee. You know, the ad hoc committee broke up at the end of July, and I think probably a little too soon. Shortly after that, I met with Representative Howard to talk about trying to find a bipartisan approach to this, and we found out that our ideas were just very, very dissimilar. We had a different approach to how we were approaching the problem. Emergency supply versus something that was, you know, really kind of ensured affordability over a longer term. And it was his suggestion that we go back, develop our plan, and then come together later. Yes, ma'am.
Will this omit the need for an emergency insulin act? For example, people that may not be eligible for this program, how do we ensure that those people will still have access to insulin?
That's a good question. So we are trying to avoid as many people needing that emergency crisis supply, but from my discussions over the last couple of weeks, I also understand, and with Senator Jensen and Abler both, that that's an important component. So we're still working through the details on that, and hopefully we'll be able to come out with something at a later point in time that helps kind of clean up that one last piece.
Senator Benson, this is a related topic, and maybe you want to defer on this question if there's other questions, but The transition, as far as DHS is concerned, moving, the direction the new commissioner is moving, what is your assessment of it at this point?
We can talk about DHS anytime. I'll take any of your calls. You know how to get a hold of me. Part of the reason that Senator Pratt developed this to run through our MNsure eligibility system is because adding something on to the Department of Human Services, I think, would be more than they need to work on right now. They have some fundamental blocking and tackling to do. So Senator Pratt wisely took our existing eligibility platform at MNsure and made that part of his solution instead of building a new bureaucracy at DHS. So I'm happy to talk to you about DHS another time. Thank you.
Senator Pratt, back on the insulin issue, yesterday Governor Walz, before he knew what you were proposing, said his fear was that this legislation would look like it was written by the pharmaceutical industry. It sounds to me like what you're saying is they didn't have much, if any, input in this?
Well, we tried to talk to as many stakeholders as possible, doctors, pharmacists, across the board. This is a program that we're holding them accountable to be a part of, to have a financial stake in. That's something that the governor said that he wanted. And so, we took him up on his word. I'm not sure if...
What will their financial stake be in this? As opposed to having, a certain fee that has been the other thing that's been talked about, what will be their financial stake or skin in the game in this?
Their financial stake is to provide that product at no cost to the patient that qualifies for the Insulin Assistance Program. And that, depending on how many people apply for that need it, will determine what their cost is.
Do you have any ballpark of what that might be, and also what the cost of the state would be?
Let's get a fiscal note.
We're waiting on a fiscal note for that, but it would be, we anticipate it would be in the millions.
Do you know how many people would qualify for the program, ballpark number?
Not yet. We're still waiting for those numbers. Yes, sir.
Just touching back, and I'm trying to understand just in the situation that I'm in. My godson died less than 90 days ago from insulin rationing. He was 21, living on his own, working 2 jobs. But he was on his parents' insurance. Now, they have 3 children, so theoretically they are a family of 5, although there's 6 in their family. Now, in your program, which income level are you going to go on? His, that he qualifies under his as a cell, or the one because he's on his insurance with his parents? Because either way, he still could not afford his insulin. So where does this come from? I'm trying to understand that. Like, is there something that's going to stop that? Because 2 years ago when they started the emergency insulin bill, we were talking about a lot of people were aging out, and my concern had always been what happens as insulin costs rise, which we still don't know why. There's an explanation, but now it's starting to affect more and more people under 26 and over 18 who are on insurance or other programs. And throughout the country, as I've been thrown and thrust into this, I get tweets, I get notes, I get letters, and not only people asking how to get insulin, can we send it to them, but also what can we do? And so I'd like to know that this is something that, it's such a rapidly changing thing. As they rapidly increase the price, I'd like to know that that's covered.
Eligibility for public programs and qualified health plans is established in federal law. There is a provision that if you are on someone else's insurance, you're not eligible for those programs. If his parents took him off their insurance, he would be eligible individually.
And so because like in here, you talk about Medicare, but Medicare doesn't cover the cost of supplies and a lot of different types of things.
Medicaid, if you're not in retirement age, 65. So at 21, Medicaid would be your coverage if you are under, I believe the number's 138, 135 with an offset.
Right.
Or 130.
Right, because it's still working.
Let me make a general comment about that, too.
Sure.
That, to the speaker, that was a really very good question. This is when we present a bill, then it actually goes through the process and all the what-ifs start coming up. And frankly, that's when you start tweaking. It happens on any bill that we would do. We think we have the perfect idea, and then more information comes, and you might have to modify this or that. But I hope you can see that we're sincere about the direction we're trying to go here, and that it is filling in a gap that we see that needs to be filled.
Senator, the very first eligibility requirement on here says you got to be a U.S. citizen or a lawfully present non-citizen. Would that, would Dreamers and some other people who are in sort of limbo status, would they qualify for this?
I think that's an old version of the bill, quite honestly. We tied it to federal eligibility. So I think what you have is an older version of the bill. We also put in there, and I don't know if it's in that version, that 90 days before someone ages off of their parents' insurance, they get a notice from the insurance company that they will be losing their insurance by a certain date. They have 60 days prior to losing their insurance and 60 days after losing their insurance to be in a special eligibility program. So that gives someone 120 days to find insurance and get insured, even after they age off their parents' insurance. Yes.
So there would be, just to follow up on that,
Yeah.
there would be no citizen requirement then? Just going back to my first question.
No, I believe we're looking at legal residence.
We'll get that clarified
Yeah.
and follow up, so thanks, everybody.
Thank
I just
you.
want to ask what plans you have for getting patient feedback and questions about claims, because clearly there's a lot of questions still that we have and you want to learn more.
You want to take that?
Sure. Thanks. Thank you. Senator Pratt has been meeting with engaged activists for quite a long time. We do have a hearing. We noticed our members to hold the date from Monday, and we'll be setting a hearing time. There will be opportunity for feedback on the bill, and whomever Senator Pratt would invite to inform the committee and inform the public about why he structured the bill the way he did and the process he's been through to get it to this point. And let me be clear, every piece of legislation that comes before a committee is a draft. And that's where the engagement starts to say, what problems do we need to solve? How much is it going to cost? Senator Pratt has a really solid start on meeting critical needs. And he has continually engaged to make sure that pharma is brought to the table and set expectations, that doctors, who are a key component, are listened to because they have a unique perspective on how to engage with patients. And so I have full faith that he is going to continue to be a leader on this and lead us to a workable solution for Minnesota. Thank you.
Thanks, everybody.